Have you noticed how hard it is to get a doctor's appointment lately and how expensive they are these days? Numbers show it's becoming a more common occurrence nationwide. In fact, one study found a third of patients say they have not been able to see a doctor in the past year due to availability issues. And for those who were able to get an appointment, nearly 1 in 5 patients had to wait anywhere from 1 to 3 months to be seen, which is not only frustrating for patients, as you can imagine, but also doctors.
Right now, things are at almost crisis level, and physicians are literally closing their practices. I think we're facing even a worsening problem in the future unless something changes.
So joining me now is Valley physician Dr. Andrew Carroll, Senior Medical Director for IntraCare. Dr. Carroll, this is so frustrating. And I noticed even for myself personally, when I was trying to book a dermatologist appointment as a new patient, I literally was looking at least 3 months down the line. Why is it taking so long for not just new patients, but current?
Yeah, when I get new patients in my office, they sometimes tell me they were waiting 5 to 6 weeks for a new patient primary care appointment. And it's because there's so many people are rising into those Medicare roles. They're passing 65 and they're needing more and more medical care as they go. So like the dermatologists like you're talking about, here in Arizona, dermatologists are probably some of our most busy specialists here. We got a lot of sun, which means we probably got a lot of skin cancer.
Right.
And those folks are booking out 3 to 4 months, absolutely.
Yeah, it is ludicrous. Really. So are you seeing this problem? We talked about how it's a nationwide problem, but are you seeing this problem here in Arizona a lot?
Yeah, you would think like Phoenix Metro, Tucson Metro, we wouldn't have a problem like that, but we absolutely have a problem. We have an even bigger problem in our rural areas like Kingman and Flagstaff and Nogales and these other places where availability of healthcare is really scarce. And these folks are having to drive 1 to 2 to 3 hours just to get to an urban center to get the kind of care that they really need.
Yeah, it's got to be, if it's bad locally, it's even worse in the rural towns, as you were saying.
Absolutely.
Okay, so what is a patient to do? Give us some good tips.
So if you are trying to get a specialist appointment, work through your primary care physician. That's your best point of contact because that doctor will probably be able to steer you to the specialists who have more availability. They also will be able to pick up the phone. If you have an emergency condition or an urgent condition that needs that attention quickly, we're often, my staff or even myself will pick up a phone and call that specialist and say, can you see Mr. Smith? We need to have him seen within the next day or two, and we'll be able to do that for you. So the most important contact you have is your primary care physician.
Okay. You also say, you know what, it's not a bad idea to see the nurse practitioner or the PA, the physician's assistant.
So if you've already established with an office, especially a primary care or a specialist office, if you've already seen the doctor and you need to be seen for something else in between, a lot of times a PA or a nurse practitioner who works with that doctor can see you in between. And if that person needs to contact the doctor, they can walk down the hall and ask the question. But it's a lot easier in most offices to see a nurse practitioner or a PA on a more urgent basis.
Okay, some people, myself included, worry, am I getting the same quality care, though, if I see the PA versus my primary?
Well, I hope so, and I hope if that PA or the nurse practitioner working with that physician knows what that doctor would do. But again, if they have a question, or even you have a question, can you go ask Dr. Smith what he thinks?
Okay.
And a lot of times they'll come down the hall and take a look.
Okay, that's not terrible bedside manners. All right. Okay, I have to ask, too, you also talk about setting up virtual appointments. That can be helpful. And again, I kind of wonder the quality of care.
One of the best outcomes of COVID-19 in terms of medical practice is the availability of virtual services. Governor Ducey put it in place where it was legal and also at parity that people could see their doctor virtually just as if they were seeing them in person. And that has carried over. So most doctors' offices have the availability of virtual services even after COVID.
One tip that I really like that you said, list out your 3 top concerns, because a lot of times people go in and then they lose sight of, the main issues or the problems that they have. And then next thing you know, time's up, gotta go.
Put it on a notepad on your phone or bring it on a sticky, whatever you have to do to list your top 3 things that you must cover. We'll try to cover everything, but if we can only cover the top 3 things, at least you got to those top 3 things.
I like that you say get your wellness exam. That's very important. But also, let's just say that, you know what, it's taken too long to see the doctor. You want to start shopping around. What should we do?
We spend much more time on a wellness visit, so make those wellness visits. We'll give you the time that you need. If you have concerns about not being seen on an urgent basis, call the doctor or talk to the doctor the next time around and tell them what you've been feeling before you shop around. Give them the opportunity to fix what the problem might be.
All right, great advice. Dr. Andrew Carroll, great to have you once again.
Thank you so much.
Thank you. Troy?